So here we have our palatal shell. We will mark our palatal shell like this one. We are going to use the clear enamel, which is a enamel shade from Tokuyama that is clear and gives us a translucency when we are going to create our palatal shell and when we want to have our translucent effect. So here I use the carver from LMR, which is called the Solo, that has the yellow color. And here I have applied some liquid on my carver, which is the modeling liquid, so I can easily model my composite on my silicone index. As we see here, we remove the excess. The line is important here to remove the excess behind the line that we draw on the palatal silicone from the beginning. And we will apply our palatal index, silicone index on the tooth, and we will light cure. We check the fitness of our palatal thickness, our palatal index with the tooth, and we make sure that there is no gap between the composite that is applied on the palatal shell with the tooth. If there is, we will apply some flowable to reinforce the shell before removing the index, because sometimes when you remove the index and you haven't reinforced your palatal index, it will break. I use a carver to distribute the composite and also light cure it. I will remove my index without fracturing, and I will apply my sectional band. As you can see, the sectional band is applied in a way when it declines downward, it is not as high as the cervical level. Here we apply some flowable composite, and then I will apply my packable composite over the flowable composite to make sure that there will be no voids between the composite and the palatal shell, because it will lead to bacterial accumulation and subsequent caries. And I will model my composite on the sectional band to create my mesial and my distal walls. This is enamel shade. This is a one, I think, yes, from Tokuyama. And this carver is also from LM Art. It is called the Applica. As you can see, the height of my mesial wall is higher on the cervical and it is lower on the incisal. We will repeat the same step on the distal wall. We apply flowable and then we will apply packable. Same steps. We create the frame and then we will remove our sectional band so we have a better access for our composite work. As you see, we have high cervical wall and lower incisal wall. We follow the inclination of the adjacent teeth. So after finishing, I will remove my sectional bands. Make sure not to break the walls in this stage because the composite is not completely reinforced. So this is OA2. I use it as Dentin. And I will adapt it to my tooth. You can use a brush, you can use a carver. I use both. Just adapt very well to avoid any spaces between the tooth and the composite because there is too much composite work here. You may have some spaces if you just do it fast. Light cure. So we look at it from this view. We have a long way to go with the composite and the Dentin shade of the composite. Here I apply another layer of OA2 composite, and same as the previous layer, we will adapt it very well to the tooth. What is important here to notice is the layers are thin because if you apply thick layers, you may jeopardize the composite polymerization because the light penetrates about 2 millimeters of composite. So we want to ensure good polymerization. When we apply our layer of composite, we will adapt it and we will distribute it on the tooth. Light cure. Sorry, we will adapt it more with our instrument. It is important when you work with composite not to finish the entire work from one view. So as we see, we look at the composite from different views to make sure that we have enough thickness of composite and then proceed to apply the next layer. So this is the third layer of composite, same as the previous two layers. We apply, we distribute, we light cure. So here I chose to use OA2 as my deep dentin layer, and I will use OA1 as a more superficial layer. Of course, when we do shade selection, we will do it in uh, by the bottom technique. We will apply our composite on the tooth and we will light cure and then we will select the shade. So here I selected the shade randomly because it's not a natural tooth, but on the natural tooth you have to make your shade selection, then according to that you will layer your composite. So as I said, I use my OA1 as the final layer and I will create my mamelons as well with this layer. So I typically start from the cervical and downward to the incisal. I love the solo instrument, especially this head, because it gives you a good handling. It makes you enables you to handle the composite very well. And I will create three lobes with my OA1, and I will proceed to condense and distribute my composite over the framework that we created. I will slice my composite and create the mamelons. Here I slice my composite. This is one mamelon, this is two. You can make three big lobes and also slice the big lobes slightly at the tip. So I look at my composite from this angle, and there is uneven distribution of OA1, so I will make them even, and I leave the space for my clear enamel. I will apply my clear enamel on this space. I condense it only on the cervical area, distribute it very well, remove the excess. My I will light cure this layer as well, and this is enough. I will use A1 as my final layer, which is the A1 corresponds to the enamel. And the difference between the A1 and the OA1 are in the optical properties. The OA has a higher chroma, of course, because it represents the dentin layer, whereas the A1 represents the enamel layer. It has less chroma and it is more translucent. So it gives you the optical properties of enamel. Here in this step, I try to make most of my work on the composite to reduce the finishing time, and I try to create the depressions on the composite itself, as I said, to decrease the finishing time. So this is our A1 as a double layer. So this orange light is from the microscope, which prevents polymerization of the composite and gives you more working time. See, I created my depressions, my developmental groove depressions on the composite itself. And as I said, you should look at the composite work from more than one angle. And I will try to create the depressions of the developmental grooves even more, as we see from this angle. So I have less finishing time, and it is also important. As you see, the mesial and the distal walls are slightly higher than the rest of the composite, so that I can create my transitional lines on this wall afterwards. From this angle as well, it's more obvious. And the patient's mouth, you can't look at the tooth from this angle directly, so you can use your dental mirror. And I use white enamel. The white enamel is less intensely colored than the A1 and the A2, and it also represents the enamel layer, so I may make some final corrections of my composite with white enamel. You can also use the A1. I just wanted to use the white enamel here. For some colleagues ask about the white enamel. As we said, it is an enamel shade, but it is less intensely colored than the A1 and the A2 enamel shades. So we look at the tooth from this angle and everything is good. So we go ahead and finish the direct composite work. So here on the palatal we have some minor defect, and we have, like here, we don't have enough composite, so before finishing we should correct that defect. We draw our transitional line, our mesial and distal transitional lines, so we can finish on them. Here in the video I don't talk about the finishing and polishing procedure because it needs a video alone, of course, and we will discuss it in the next video. Here I will use a disc to create my transitional line. So the transitional line, if they are closer to each other, it will give the illusion of a narrow tooth. If they are far from each other, away from each other, they will give it in the illusion of a wider tooth. So it depends on your case and what do you want, a wider or a narrower tooth. So I will finish on the composite, and I will use a set of other burrs, not just a disc. So this is my polishing and finishing and polishing kit from TWINKLE. I will use the green one to mark my developmental grooves even more, but I will not work on it with it so much because I already created most of it with the composite itself. So the finishing step is very important because if you have any defect when you polish or give the final gloss to the tooth, it will appear if you have insufficient finishing and if you have scratches and if you have irregularities. So this is pre-polishing. We can see fine lines and good finishing, of course. And if we see this result in the pre-polishing, we will continue with the polishing and the final luster when we give the final luster to the tooth. So this is the final luster. We see great light reflection, and we have our developmental grooves, and the mesial and distal transitional lines are very evident. So I use this burr from the TWINKLE system as my final burr. So here we can see the finished direct composite, and it's highly polished. Of course, the polishing is important because if you do not polish the composite very well, you will have a plaque retentive composite restoration and it will lead to gingivitis and also secondary caries. So take care and give time to the polishing.